Your best ally in health really came from a couple of things. One of them is through my work as an integrative health coach. So I partner with people around behavior change. And I find that this approach works really well. So it's really putting people in the driver's seat and approaching all the dimensions of their health. So they really take charge of where they want to start with behavior change. So it's a behavior change model. And one of the ways that I connect with people is a technique called motivational interviewing, which I did not invent. That was Miller and Rolnick. And with this technique, really, it honors the person, the individual, as being the expert on their own health, because they were there, they know themselves the best. This is how the concept plays out. And supporting people in the various dimensions of health behavior change is what I do and what this technique uses. Thinking about the suppers programs, we put our people in the driver's seat. They want to make some changes with food, with their health, and how can we sort of really think about the concepts and our pillars, our supporting pillars, to help people make those changes. So that's where the concept came from, and we're continuing to build on it. Well, encouraging people to be at the center of things for the suppers community means them deciding, people deciding where they want to start. As you know, we don't tell people what to eat or how to eat, or we don't give out advice, which can be a little bit unnerving sometimes. Some people might think they're going to come along and be told what to do. In fact, it's the converse, isn't it? But we lay the table for them, and we have a non-judgmental environment. As you know, it's one of our fundamental pillars, and we encourage people to experiment and make observations about how food affects them. We also explore the ways that people can get support, whether it's through their peer trained facilitator or their fellow participants, fellow chefs, and the wider community, which is where people like Adi, Dr. Benito come in with the integrative medicine approach to healthcare, where the person is right in the center.
Yeah, I think that, one of the beauties is that it's not just to say, here, just try something, just figure out what works for you. I think Suppers has already done the work now, and we have not only can present to people different ways of eating, but we can help them figure out how that will work for them. How can they figure out that will work for them? So we've already done some of that work that they don't have to be on their own, right? We have that guidance for them. So we have the breakfast challenge is one of the things that we offer to help people figure out if a particular way of eating will work for them. We have an experiment, that's what we do. We have an experiment, but we guide them through this experiment, so they don't feel lost in trying to say, how do I do this? How is that going to fit into my life? And am I even going to know how to cook this? And how am I going to make something taste good? I think when we first, for somebody who gets a diagnosis and they feel that they need to eat differently, the first concern is, am I going to enjoy, my food? How am I going to enjoy food anymore, right? And I think Suppers has really done a tremendous job of really working recipes and making them be delicious.
Many people have tried before, and with a fairly prescriptive approach, say if it was weight loss and going to a program where they feel shame or blamed, but they haven't developed the techniques for long-term change. So we can meet people where they are and we really help them to make those small changes and hopefully start to develop the taste for healthy food and the tools and the techniques and the spices and the herbs and the way you cook it. Yeah, so it's not a loss, it's eventually a gain. We're not saying it's easy.
She said that she had actually been eating more sugary foods and more caffeine because actually it was giving her energy. So we explore that together. And, I think that some people, the idea sometimes is that, yes, sugary foods might give you some energy, but in the long term, they're not going to give you sustained energy and they're going to give you these ups and downs of sugars. So once she was able to see that, then she was able to make some modifications to ways for her to figure out how to get more energy. So for her, it actually was to have a bit more protein for breakfast. So realized that she was not eating, enough protein for breakfast. And that actually helped her then not need to have, so much sugary foods. And she wasn't needing caffeine late in the day. That also was not allowing her to sleep well. So, just making that change. And it's interesting because, sometimes helping people understand how our bodies work, right? So if we know that if you eat a lot of sugary foods, because your sugars have such a big spikes, that actually can affect your sleep, right? But then the lack of sleep can also make you want to eat things that are more sugary and more rich in fat. So it's this vicious cycle, right? So you have to, at some point, have to figure out, okay, what can you do and what works for you, right? So you bring it back to the person. What works for you? What have you done in the past when you felt well? What was that you did that actually helped you?
You are capable, and start small. Get meaningful support, and suppers are here for you.
Yeah, I think that innate wisdom, right, that we all have, I think to honor that innate wisdom. And then if you're really stuck and don't know how to get about, then reach out. Definitely Suppers has tried it out, has a lot of different ideas. It's just trying to figure out what works for you. And you're the person to know that.